Good morning. Myself Shweta, Senior Nursing Tutor from RPMS बस्तारा करनाल. आज की यूट्यूब वीडियो में हम डिस्कस करेंगे टाइप्स ऑफ फ्लूइड. वी हैव थ्री टाइप्स ऑफ फ्लूइड: आइसोटोनिक, हाइपोटोनिक एंड हाइपरटोनिक. फर्स्ट ऑफ all is isotonic fluid. Isotonic solutions has the same concentration of solute as the fluid inside the cell. There is no net movement of water into or out of the cell, and the volume of cell remains stable. Concentrations in isotonic fluid. Isotonic fluids are the safest for routine use because they do not cause significant shift in fluids between compartments, intracellular, extracellular. They are ideal for fluid replacement such as after surgery, trauma, or dehydration, as they help restore fluid balance without altering cell volume. These fluids are commonly used in IV rehydration therapies for patients experiencing blood loss or dehydration. Example: 0.9% normal saline used to treat fluid volume. Commonest सबसे common isotonic fluid है lactate ringer solution, commonly used during surgery, trauma, or for replacing lost blood, and fluids containing electrolytes like sodium, potassium, calcium, and lactate. 5% dextrose in water, D5, initially isotonic in the back but becomes hypotonic in the body because as the dextrose is metabolized. Effects on cell. Since there is no concentration gradient between the inside and outside of the cell, water move equally in both directions. Cell maintain their normal shape and function without swelling or shrinking. Use for fluid resuscitation in cases of shock, hemorrhage, dehydration, or surgery. For maintenance of fluid balance in patients who cannot drink or consume enough water only. Used in fluid replacement therapy for patients with low blood pressure or in those receiving blood transfusions. नेक्स्ट वन इज़ हाइपरटोनिक. हाइपरटोनिक के नाम से ही आप समझ सकते हैं दे हैव हायर कंसनट्रेशन ऑफ सोल्यूट्स कंपेयर टू द फ्लूइड इनसाइड द सेल. This means that there is less water in the extracellular environment compared to inside of the cell. Hypertonic solution should be used with caution because the rapid movement of water out of cell can lead to dehydration, particularly in brain cells, potentially causing conditions like cellular dehydration or fluid overloading the bloodstream. Close monitoring is needed when administering hypertonic solution, especially in patients with heart failure or kidney disease. Example is 3% saline solution, 5% dextrose and 0.9% saline, 10% dextrose in water. Effects on cell. When cells are placed in a hypertonic solution, water moves out of the cell. In plants, the plasma membrane pull away from the cell wall, a process called plasmolysis. Over time, if water continues to leave the cell, it becomes dehydrated and may even lose its ability to function. Hypertonic solutions are used when it is necessary to draw fluids out of the cell or to reduce edema, such as cerebral edema. They are also used in situations requiring electrolyte replacements, like in severe hyponatremia, can be used post surgery to reduce the risk of clotting. The fluid will come from the interstitial space to extracellular space in hypertonic. A hypertonic solution has a low concentration of solute than the fluid inside the cell. This creates a situation where there is more water outside the cell related to inside the cell. Concentration. Hypertonic fluids must be administered carefully as rapid administration can cause cells to swell excessively, leading to conditions like cerebral edema. These fluids are typically not suitable with patients with increased intracranial pressure, burns, trauma, as they can worsen the edema. Hypertonic solutions are generally used when cells are dehydrated and need water. Examples of 0.4% saline, 0.33% saline, or 2.5% dextrose in water. Effects on cell. Water moves into the cell via osmosis, causing the cell to swell. If excessive water enters, the cell can burst. In plant cell, we will leave it. Uses. The solution are used in conditions where intracellular dehydration exists, such as in hypernatremia, where cells are dehydrated and need water to restore balance. In some cases, they can be used for diabetic ketoacidosis after initial rehydration with isotonic solution. Now I will end this YouTube video here. Please like, share, and subscribe to our YouTube channel RPIT Academics. Thank you so much for watching.